Let us now review needling the points of the extraordinary vessels. Okay, let's start with number 1. Which point is described as strengthening and consolidating the renmai, often used without accompanying opening points? Actually, this is my favorite point.
Oh. Run for.
Ran 4. Number 2, which pair of points constitutes the host-guest technique for opening taimai, the belt channel, belt vessel ba yan?
Belt, girdle.
The girdle vessel, yeah.
GB41 as the host and triple burner 5 as the guest.
Okay, so taimai is GB41, TB5.
5, yeah.
In the treatment of unilateral sciatica using yang chow mai, one sometimes deviates from the sex-based rule, of course, diba? Which configuration is recommended?
For unilateral. Opening point on the painful side and then coupled point on the opposite.
Yes. So the painful side is the opening point. So this is regardless of gender, no? Okay, so for yang chow mai, to treat unilateral sciatica. Usually kasi sciatica unilateral. Which vessel's opening point coincides with its starting point, allowing one to use it alone. This is so effective, promise, for insomnia treatment.
The yin chow mai.
Yin chow mai. When combining additional limb points with the opening and coupled points of an extraordinary vessel, inserting them in which order is advised?
From the top of the body downward.
Yes, top down. Kidney 13 is noted for having a powerful effect on which vessel, despite the vessel lacking its own dedicated points?
Chong.
Yeah, Chong Mai. This is my favorite for women with menstrual issues. Yeah. Kidney 13, it's so helpful. Which historical source first described unilateral and crossed over needling according to sex?
Sun Si Miao's 1,000 golden ducats prescriptions.
For a woman with kidney yang deficiency causing backache, what is the recommended sequence of opening and coupled points?
SI3
Okay.
the right, and then lung 7 left, and then kidney 6 right, and then bladder 62 on the left.
Oh, di ba nice?
Yes.
Sa right.
A woman.
Yeah, SI3.
Kidneys.
Left yung lung 7. Tapos, actually, lung 7 and kidney 6 yan, di ba? Oh, opening and ano. Okay. So, pag right and left, tapos yung left and right. Okay. Number 9, which point is used to open the renmai in a man according to sex-specific protocol?
Lung 7. On the left.
Using too many additional points may impede chi movement, especially in the presence of which conditions?
Scars or boils with pus.
Dump heat na dump heat. When treating menorrhagia with both DU and renmai, which set of points is prescribed? Actually, this is very common, huh? This is also my favorite.
Yung points kanina. SI3, lung 7, kidney 6, bladder 60.
Actually, yung technique ko, pag babae, parehong SI3 and lung 7. Hindi pa
7. On the right.
left na naman yung lung 7, no? So parang yang, tapos yin, yin, yang. Okay. Which of the following statements best captures the stance on using two extraordinary vessels simultaneously, excluding Du and Renmai. Pwede bang gumamit sabay?
One avoids simultaneous use, opting for successive treatments.
Okay. In the context of the Yang Chao Mai, which combination of points would open the vessel and direct treatment to the scapular area?
Bladder 62 and SI3 with SI10.
Yeah. Which point is described as strengthening the fire of the Mingmen?
Do for
The protocol for opening the Chong Mai in a woman includes which initial pair of points?
spleen 4 on the right and PC6 on the left.
Yeah, partner niya si ano, no?
Yeah.
Sa kabila, opposite si ano. Okay. Which point is the opening point for Yang Chao Mai?
Bladder 62.
When withdrawing needles after 20-minute treatment, what is the correct order for the opening and coupled points?
Withdraw the coupled point first, then the opening point. Babalik.
Yes. Baligtad. Which of the following best explains why Chong Mai is considered in between the Du and Ren Mai and the other vessels?
It lacks its own points but traverses all kidney channel points, granting it moderate influence.
Which point serves as the coupled point for Ren Mai when treating a woman?
Kidney 6.
Kidney
On
6.
the right.
Which vessel's opening point is also its starting point, making it unique among extraordinary vessels?
Yin Chao.
Yin Chao Mai. Kaya ano, effective. Yeah, there is a specific sequence for treating chronic urinary problems. Which vessel pair is employed? This is also very common. Ha? Makikita nyo talaga ano, parating may UTI ang pasyente.
Du and Ren Mai.
Yes. So how is the sequence?
uh,
Ang sev, yeah.
no, SI
SI3,
SA3 on the right,
tapos lang 7 sa left.
7 left,
And then,
kidney 6 right, bladder 62
bladder.
on left.
Okay. When using the opening and coupled points of an extraordinary vessel with additional points, what is the maximum number of extra points recommended?
4 or 5.
Which historical text does not include the unilateral sex-based needling rule for extraordinary vessels?
The Great Compendium of Acupuncture. Herbs.
Yeah. For a male patient, insert the opening point of the renmai on which side?
Left.
Which point is the opening point for the dumai?
SI3.
Which point is used to tonify yin chow mai when treating insomnia?
Kidney 6.
Yes. Ang ganda niyan. Super.
For insomnia.
The host guest terminology originates from which classic acupuncture text?
Wait, asan na ba tayo? Host guest. San Si Miao's 1,000 Golden Ducats prescription.
Sikat talaga sa Sun Si Miao.
San
Which
Si.
2 points are recommended for opening the Yang Chow Mai in a typical non-pain situation?
Bladder 62 and SI3.
So si Yang Chow Mai, kapamilya niya si Dumai, no?
Yang Chow 2.
Yeah, kasi ang Dumai SI3 and bladder 62. Samantala si Yang Chow Mai, bladder 62 and SI3. Si Ren Mai naman, lung 7 and kidney 6. Pero si Yin Chow Mai,
May ang
opposite, no?
mm-mm.
Kidney 6. Easy, no? In treating Yin Chow Mai related abdominal pain, which adjustment to the sex-based rule does one sometimes make?
Use the opening point on the side of pain, coupled point the opposite.
Yeah, basta pain, opening. At least lesser lang needles, no? Which vessel's points are said to have very limited effect when used alone, primarily serving to direct treatment locally?
Yang Chow.
Which pair of points is used to treat chronic urinary problems in women, reflecting a combined do-ren approach?
SI3, lung 7, kidney 6, bladder 62.
Diba? Madami ganyan. Which of the following best describes the technique for needle retention time?
20 minutes.
20 minutes.
For the Chong Mai in a woman, the opening points are combined with which two Ran Mai points for rebellious Chi? Ito, ano din to? This is very true. I have a patient I've been seeing for like quite some time now. When I needle talaga, Chong Mai pati Ran Mai, hindi talaga siya.
Ren 15 and Ren 4.
Yes. Which point is the coupled point for the Yang Chow Mai when the opening point is bladder 62? Very easy.
SI3.
Which vessel is most commonly paired with Ren Mai in women to address kidney yang deficiency?
Dumai.
Which point is used to drain Yang Chow Mai when treating insomnia?
Drain. Bladder 62.
Yeah. Drain. The
Drain.
description of opening and coupled point unilaterally and crossed over according to sex applies to which of the following vessels?
All extraordinary vessels except Yin Chow variation.
Which point, when needled alone, is said to have very little effect on its vessel, requiring accompaniment by opening points?
SI10.
I10.
The Chong Mai traverses which channels points from kidney 11 to kidney 21?
Kidney channel.
Point serves as the opening for the Ren Mai in a woman according to the sex-specific protocol. Paulit-ulit lang.
Lung 7 on the right.
Which point is the guest when opening the Ren Mai in a man?
Kidney 6
6.
on the right.
When treating insomnia with both yin and yang Chong Mai, which additional point is employed where the two vessels will intersect?
Bladder 1.
Bladder. Which methodological principle is followed when withdrawing needles after a treatment session?
Withdraw coupled points before opening.
The Great Compendium of Acupuncture recommends needling the opening point first. Which term does it assign to this sequence?
Host-guest technique.
Yes. Which pair of points would address rebellious Qi in the Chong Mai for a female patient?
Spleen 4 on the right and PC6.
Yeah. This is very true. Alam niyo naman, rebellious Qi, yung gugurd. Ang tagal na daw hindi na but diretso kagad, spleen 4, PC.
PC6.
Which vessel's opening point is the only instance of using a single point without its coupled counterpart, as mentioned for insomnia therapy?
Yin Chow.
For a male patient, which side does one place the coupled point for the dumai?
Right.
Right.
Okay. Grabe mga tanong. Which point is identified as the opening point for the yang chow mai's function of absorbing excess yang energy in the upper body?
Bladder 62.
Siyempre, pag upper body, the farther, the better. Mas malayo, mas maganda. The rule of no more than 4 or 5 additional points is primarily intended to prevent what?
Prevent impaired chi
Chi.
movement due to limb needle overload.
There's such thing. Kaya dapat bawasan na, no?
As much as possible.
Yes.
Less need.
Which point is described as moving chi in the Renmai needle?
Moving. Ren 6.
6.
Nagmo-move Ren 6. Which vessel's treatment may involve draining rather than tonifying for insomnia? Draining?
Yeah. Draining. Yang Chow.
Chow Mai. Wow, congratulations, everyone.
Thank you, Doc.
Thank you.